Uganda's immunization coverage has increased in the last 10 years, but immunization programs still face numerous challenges. These include large disparities in coverage between urban and rural centers, a high immunization dropout rate now at 44%, vaccine shortages, and the communities that are not sensitized on the benefits of vaccination.
Lack of proper public information. We need to give correct information to our communities so that they do not come up with all kinds of rumors that stop them from getting the vaccines.
According to a new report by the Advisory Committee on Vaccines and Immunization titled Improving Vaccine and Immunization Coverage in Uganda, the country consistently performs far below its neighbors in the coverage of almost every vaccine. Uganda also remains far behind in the global immunization vision and strategic goal of 90% diphtheria, tetanus, pertussis, DTP3 national immunization coverage and at least 80% in every district in the country. Government now plans to introduce new vaccines, including against diarrhea in children, and also roll out universal vaccination against the human papillomavirus that causes cervical cancer.
There are new vaccines in the pipeline. For example, a vaccine that stops one of the causes of diarrhea. It's called the rota vaccine that is going to be introduced. There is the pneumococcal vaccine, a vaccine that prevents chest infections that commonly affect young children. That also is going to be introduced in this country.
According to the Uganda Bureau of Statistics, about 4% of Ugandan children have not been vaccinated, while 44% have not completed their vaccination doses. This means a large part of the population has no immunity to deadly diseases. The poor funding of immunization programs has also affected service delivery. Government spent just 8.66 billion shillings or 3.6% of the total 434 billion health budget in the 2009-2010 financial year on immunization, with most of the burden borne by development partners. There are calls for additional government input, including increasing the number of staff at the Uganda National Expanded Program on Immunization, UNEPI, the agency charged with promoting immunization in Uganda.
The health workers who should be providing these vaccines are not enough. There are not enough health workers in the country. Secondly, that the budget, the amount of money that is putting into supporting vaccine program is not adequate at this time.
There are 25 immunizable diseases in Uganda. Commitment from stakeholders therefore doubly necessary to safeguard Uganda's children and ultimately development prospects. Yabasetumba Abubakar, NBS Television.